And then you're gonna look at the uterus. So usually the fundus should feel firm. So you're gonna hold down on like the bottom of her, like close to the symphysis and the symphysis pubis, and then you're gonna be on her belly button and push down. You should feel tenderness, firmness there. If it's soft and doughy, that's bad, and you should be able to find it. It should be midline within the body, and if it's boggy, the urinary retention can cause it to be tender as well. The bladder shouldn't be palpable. They should be voiding at least 4 to 6 hours to make sure that the kidneys are working and that they're going to the bathroom, that they're drinking. And they shouldn't feel any discomfort, so you can ask them if they've felt any pain or stinging when they're peeing. And the bowel sounds, you're going to listen to in all 4 quadrants, starting on the right bottom side. So you're going to go around and listen to those bowel sounds. They should be active unless they've had general anesthesia. And they should be able to have a normal bowel movement between 2 to 3 days. You're going to look at the lochia, which is like the bleeding postpartum, so they're going to have pads on them after they give birth, and you're going to measure those pads to see if she's bleeding too much or if it's a normal amount. So you're going to be looking at that, and there shouldn't be an odor present, and it should be red. So if sometimes it's clear, it shouldn't variate from that. You're going to do Hellman's sign, which is especially looking for edema, for blood clots and stuff like that. You're going to look at the legs and feel for pitting edema. There shouldn't be any tenderness. So whenever you have the foot, you're just going to hold under the leg, pick it up a little bit, and then you're going to flex the foot forward. If she feels any tenderness in her calf, then that can be a sign of blood clots, which is not good. And deep tendon reflexes would be just like flexing the foot and making them, against your hand. And episiotomy. If she's had an episiotomy, you need to check the laceration, make sure that it's not getting worse, there's no redness, no edema or bruising, and look at the drainage. Usually if it's a clean cut, there shouldn't be any drainage with it. There might be drainage, but it should be to where you can't see the staples. Sometimes you can, but you're going to be looking at that approximation. So when it's closed enough, there shouldn't be any gaps or anything in that, and it's going to be low where she got her incision. But if it's an episiotomy, it's going to be in her genital area. So you're just going to have to check that. And pain is normal in postpartum patients because they just came from a huge procedure. So pain should occur between 2 to 3 days, and that's normal. For weight loss, you're going to be looking at that, usually 10 to 12 pounds at first, and then once they start eating again, it'll return to their normal weight between 6 weeks and 6 months. And their emotional state is usually drained, but sometimes moms can go immediately to caring for the baby, or sometimes they go all on themselves. So you're going to ask her, how has your emotional state been? And just observe the interaction between her concerns, how she's dealing with her baby, if she's, all about the baby, or if she's kind of all about herself and recovering. So, that's basically it. Oh, with the breasts, you're also going to palpate them with the back of your hand, and sometimes they can feel, you're just going to make sure, ask her if they feel firm, if they feel full, if they feel tender, She shouldn't have any issues with that. Ask her about breastfeeding. If she's feeling pain, she shouldn't feel pain, and if she is, you want to help her next time she tries breastfeed, because she's not going to want to breastfeed if she's in pain with that, because she's already in pain from, you know, the vaginal birth or the C-section. So, and the nipples, sometimes they can be inverted or exverted, which is normal. Sometimes they can be different. One nipple is exverted, one's inverted, and that doesn't really stop or inhibit their way of breastfeeding. Sometimes the nipple doesn't retract. So yeah, just making sure that they're normal, there's no changes to them, and making sure that they know that they need to wear a supportive bra with that. So I think that's it. And that is the conclusion of my postpartum assessment.